I'm going to take a look at the muscles which move the scapulothoracic joint in its four directions: elevation, depression, protraction, and retraction. So let's start with elevation. The main muscle involved in elevating or raising the shoulder blades up is this muscle right here on either side. This is called upper trapezius. Given its name trapezius by its diamond shape or trapezoid shape. It's a very large muscle, trapezius. Upper trapezius does elevation. There's a muscle deep to upper trapezius on the lateral surface of the neck, which attaches to the superior angle. To remind you up here, the superior angle of the scapula is called levator scapulae. And levator scapulae and upper trapezius work synergistically, meaning they work together to accomplish the same thing, both elevating the scapulothoracic joint. Let's now look at muscles which will protract the scapula. Muscles which protract the scapula are going to need to pull the scapulae forward. One of the main muscles which does that is over here on the side, called Serratus Anterior. It attaches to the ribs and then wraps its way underneath the scapula to attach to its medial border, attaching to this border over here. So if this is Serratus Anterior coming around like this, as the muscle contracts, the scapula pulls forward. Serratus Anterior. There's another muscle deep to Pectoralis Major called Pectoralis Minor. Pectoralis Minor is also involved in protraction, protracting the scapula. Now let's look at some muscles which will retract the scapula. Turn around here. The two main muscles involved in retraction the scapula are middle fibers of trapezius. Notice that muscle fibers will pull parallel to the direction. A little bit difficult to see on this model, but the fibers are running this way. So when they contract, they'll pull the scapulae towards each other. Or if we're looking at one, pulling towards the spine. This is middle fibers of trapezius. If we were to look deep to middle fibers of trapezius, as you'll see in the image below, rhomboids is the other muscle. Rhomboids and middle trapezius both retract the scapulae. Finally, depression of the scapulae. The main muscle involved with that is lower fibers of trapezius. These fibers are angled in this direction. As they attach to the scapulae and attach to the spinous processes down here, they will pull the scapulae down. Another muscle, which we've already talked about on the front, underneath or deep to Pectoralis Major, Pectoralis Minor, is a small muscle which attaches to the coracoid process, this large process that we've looked at before. And if it attaches from here to the ribs, it will pull the scapulae down or depress the scapulae.